It's not easy. It's not easy to do that, and so most clinicians, their jobs are fairly busy, and it's quite easy to have those clinical roles just sort of take over and become all-consuming, really. So if you are interested in whether it's pursuing management or teaching or research, you do have to carve out and protect some time to do that.
It has its challenges. The NHS is a very pressured organisation. We've got an awful lot of work to do and not enough people to do it. But I think it is selling that improvement in quality of what we can deliver as a key factor in it, really. I think that's the most important driver for it. I think people have to want to do it for it to work. But recognising that link with quality of care, recognising that link with improved patient outcomes is what will make people think that little bit differently in terms of saying, well, this is my agenda, it's very important to patients, we should just get on and do it.
People, even though I've been in research a long time, people still think as a research nurse, midwife, AHP as somebody that might sit behind a desk, but that's not the case. They still get that patient interaction and that patient contact, which is something that a lot of people don't want to miss. There are lots of different opportunities that they can get involved with research within our organisation and across our region. And as I say, the CRN East Midlands are a really big link for us as well across our trust.
So the idea that we had within the surgical division was very much around the junior research fellows, and that was getting them involved and active in research in their ward and environment, and also becoming more competent and confident around the specific research competencies.
A secondment like this is a perfect opportunity. It's 1 day a week, so it means that you can still carry on in your main job and your main role. You're not committing a huge amount of time each week. It's 1 day a week over 6 months this secondment has been. It allows you also it gives you a lot of thinking time in between your research days. So I think there is a benefit in doing the 1 day per week in that you can read around and you can look things up before you go back to your actual involvement in the studies.